Thank you everyone for joining us today for our presentation, How 500 Hospitals are Achieving High Reliability with Assessment-Based Personalized Learning. This webinar is designed as an introduction to GNOSIS for OB, with a special lens for those of you interested in the new content partnership between GNOSIS and AWHONN. Right now, everyone is signed on and muted, but if at any time you have a question, please type it in the chat box and we will answer those questions at the end. My name is Tom DeSantis from Advanced Practice Strategies, and I'm glad you could join us for the next half hour. When we were planning this presentation, we tried to imagine the questions you might have, realizing some of you may never have heard of GNOSIS before the invitation. Some of you are evaluating GNOSIS for your hospital or your health system. And many of you are AWHONN instructors looking to learn how GNOSIS can enhance your instruction and the learner experience. So today we will cover what is GNOSIS. We'll explain what we mean by assessment-based and personalized learning. How is GNOSIS different? In other words, what makes this the most unique model in the industry? What is the impact of the GNOSIS model? Specifically, how is the learning process impacted? What results are GNOSIS clients achieving? We'll look at several studies. And what is the partnership between GNOSIS and AWHONN? I'm sure you're wondering, what does this mean for you? Before I introduce today's presenter, I wanted to provide a brief company overview. We are Advanced Practice Strategies, or APS. We provide solutions to hire, onboard, and develop the best people. We work with over 500 healthcare facilities through our two assessment-driven solutions: Proficiency, helping to improve nurse retention, and GNOSIS, helping to improve patient safety. Combined, we work with health systems to build the best clinical teams because we believe you already have the key to high reliability. It's your people and your investment in their success. Here to provide your introduction to GNOSIS for OB is my colleague, Lora Sparkman. She's APS's Vice President of Clinical Effectiveness. Laura joined APS in January 2014 after 17 years with Ascension Health, the nation's largest nonprofit health system, where she served most recently as Director of Clinical Excellence. In that role, she supported one of the largest obstetrical research grants from the Agency for Healthcare Research and Quality on developing new medical liability models while improving patient safety. Additionally, she was instrumental in developing Ascension's perinatal safety program that included GNOSIS for OB. Laura, thanks for joining me today.
I'm very happy to be here. Thank you, Tom.
Yep. Let's jump right in and tell everybody about GNOSIS.
It sounds great. So first I want to say welcome to everybody that signed up for our conference call, and thank you for giving us your time today. I hope that everybody gets an opportunity to really understand what GNOSIS is and how it works, and we're going to just jump right in as Tom alluded. So in this first slide, really what you see is many different views of how you can access GNOSIS, because the GNOSIS is an assessment-driven education and analytics platform that is transforming how doctors and nurses learn through the power of data. You see a laptop, a desktop, an iPad, and because you can access our content through anywhere you can access the web, this makes it very convenient and an effective learning method for busy clinicians. So how does GNOSIS work? We really offer a very unique way to deliver education. It's an innovation that has come to life. It's an assessment-based, a validated assessment-based education model. We measure knowledge and judgment, which can measure proficiency, does measure proficiency. It delivers a personalized learning path because it is assessment-based. It delivers in a prioritized manner only the content that you as a nurse would need. And because it is assessment-based, it generates analytics. And that's really important in the adult learning science and model, because as an individual frontline user, you need to know and get that feedback how you did compared to your peers nationally. And we provide that to you because we have a very large database. What that means, and we're going to go into a lot of the detail around that, it can improve patient safety and it mitigates risk. It gives you an insight into your team and as an individual, what do I need to focus on and how can I better myself as a clinician? So GNOSIS is very different because we provide the data, as I was just talking about. We measure two primary variables, judgment and knowledge, and you see that on the X and the Y axis. What we really are delivering is a standardized, validated assessment for several different high-risk areas in obstetrics. And what you're seeing here is an example of the 70,000 completed assessments that we already have in our database. What you're very easily able to see is that there's a wide pattern of variation across those 70,000 completed assessments. The dotted lines in the middle represent our average for the U.S. in our database. You're able to drill down. This blue dot can represent, for example, imagine that's your health system compared to the national average. And then we can continue to drill down if you're a multi-hospital health system and see how one hospital compares to another hospital within your own health system. And we continue to drill down into the individual clinician view. Imagine this is a labor and delivery nurse unit and you're seeing the variation among your team. Really important to know so you can support their learning. And then you reassess after a defined period of time and you see that movement up and to the right, which represents the highest scores in knowledge and judgment. And that's the piece that's been missing from traditional CME, CE education as we know it today. And you all being nurse leaders, nurse educators, frontline care delivery team members, know what it's like to work with a very well-prepared team and what it's like to not work with a prepared team. And our tool helps improve knowledge and judgment. So as I had mentioned, a big differentiator for us is that we do measure judgment. And we do that in a lot of different ways. One way is through a model of script concordance theory. We measure how closely your answer concords to the experts in the field. The questions are designed by your peers, providers, and nurses in the field. And we give you, this is an example on an iPad, a question, a clinical scenario. You're asked to give 3 answers, and then it gives you immediate feedback. This particular example shows that all 3 correct answers were selected, and then you're also provided feedback. We also provide you the National Evidence-Based Practice Standards. This is an example of a Rubens maneuver from our shoulder dystocia program. If you're actually in the program, you'd be hearing narrated guidance as what's actually happening, how the Rubens maneuver should be applied, what's happening to the neonate as you're trying to release that shoulder in the shoulder dystocia presentation. It's high fidelity, it's 3D, you can move in, you can move out, you can turn upside down on top and get a view that you've probably never been able to see before. But that's one of the unique factors about our content is we are very high fidelity and not the traditional flat file education where you're reading content or looking at an image and not interacting with the content. This slide here really starts to get to the impact of GNOSIS and how it's starting to make learning more efficient. Because we are an assessment-based solution, your learning path is generated based on your assessment results. So in the gray bar in the column up top, 8:15 represents 8 hours and 15 minutes of our traditional long-form course, or what might be a traditional education where nurses come out of practice for a day and go receive education and training. GNOSIS basically comparing our traditional long form to the GNOSIS model, an assessment on average for nurses is 1 hour and 20 minutes, and the learning path is 2 hours and 46 minutes. That is over 4 hours in saved seat time because the nurse is only getting the content that they need and not getting continually exposed to content that they've actually tested out of. That's a very big satisfier, and it's very efficient as well. Additionally, the impact of GNOSIS helps increase engagement. So we did a little study using our old long-form course of fetal assessment and monitoring, compared it to our new GNOSIS program, and found that nurses actually stay in the content 3 times more than they did in the traditional content, and physicians stayed in the content 6.7 times longer. So going from 25% to 75% in nurses and 12% to 80% in nurses. So again, this is an indicator to us that clinicians are more engaged in the content when they're getting that feedback from their analytics after you complete your assessment. This is the content you need, and this is how you compare to your peers. And it really motivates the learner to go into the content and focus on their priority areas for learning. This is an example. Again, I think it's really important. We wanted to show you impact of facility improvement. This is de-identified data from one of our clients. It's an 11 hospital health system, and these orange boxes represent each one of their 11 hospitals. The black triangle represents the facility, the system average. Okay, so really what you're seeing is 2 orange boxes are in the highest scoring upper right quadrant, and the remaining hospitals are in the lowest scoring quadrant for both knowledge and judgment. The overall system average is below the APS average in knowledge and judgment. And then again, this is compared to almost 16,000 nurses for their 325 nurses across their 11 hospitals. So as a clinical leader, as an educator, this is really important information that you want to have. This tells you what your baseline data is. Keep in mind, this is right after the assessment, before learning occurs, before they get their learning path. But it's important because it helps you identify where the system variation is, how they're comparing to their peers nationally. Again, we have the largest database in the country for fetal assessment and monitoring and several of our other programs. And so it's a reliable measure of proficiency. This is the second assessment. So after a period of time, whether it was, between a year and 24 months, because the learning model is and how adult science has really guided us in terms of how we develop GNOSIS, is you assess, you learn, and then you practice, like work. You're actually doing work, doing patient care, and you're retaining that information. But over time, that information starts to degrade, which is why it's important to reassess again. But what we're finding time and time again is we're seeing improvement. So keep in mind the baseline assessment image that you saw. This is this health system's second assessment, and every health system, every hospital moved up and up to the right, and the scores improved. This is a dramatic example. We don't necessarily see this type of improvement with all of our health systems, but we are consistently seeing improvement. And again, it's exactly, I think, what educators have been pining for, which is really to say and validate your work effort. The education we're providing to our clinicians, our front line, isn't making a difference. And through GNOSIS, we're able to show you that it is making a difference. We also measure in the course, again, as you see, knowledge and judgment at the top. The red to green band represent the national database. Red, that band is the 0 to 25th percentile, with green being 75th to 100th percentile, just to give you a lay of the land of this graphic. But you'll see these 4 practice areas. This is an example of our fetal assessment and monitoring practice areas and the content that we measure clinicians in, whether they know the national evidence or what they know regarding the national evidence. We measure do they understand the NICHD National and Common Language and the categorization system? Can they evaluate and manage and respond to Category 2 effectively and efficiently? Can the clinician evaluate and manage and act accordingly for Category 3, which we know by the NICHD are abnormal tracings? And then are they able to assess, we assess knowledge for appropriate risk management practices. So really the use of and the application of electronic fetal monitoring. This is their baseline assessment. Again, this is a standard report, and this is the after they've completed their learning and reassessed. And you can see the gray dots that represents their baseline results by practice area and where they've achieved and improved. And this is, again, a phenomenal improvement story. And they went from the lowest scoring quartile to the top scoring quartile, which from an education perspective is exactly what you want to see. There's a lot of implications around this. You're seeing standardization, you're seeing improved teamwork and communication, and we're starting to see other impacts around quality, patient safety, and reduced risk. So one of the questions we get asked often is, you know, what learning is really taking place? So we actually did a study of 700 physicians and nurses completing a personalized learning path. And through that study, what we found is that for those individuals that were in that lowest scoring quartile, the 0 to 25th percentile, actually improved 37 percentile points. So they went from below average to above average, which is a pretty impressive result. And again, that's the fruit of the labor of the educator, and we are able to demonstrate improvement, which is exactly what we want to do. So GNOSIS also helps reduce risk. We have a client who's been with us for a very long time. You'll see the footnote, super tiny writing, but it's Beta Healthcare in California. They have been a long time user of ours. It's a risk company, but they had a program called the Quest for Zero, and required as part of their Quest for Zero that all of the hospitals and clinicians, 100% nurse physicians, nurse midwives, complete the GNOSIS program. And they saw a reduction in their claims. They saw a 55% reduction in exposures. These dates, the 2008 to 2011, the thing you have to keep in mind is that claims have a tail 5 to 7 years. So this is very relevant data. Anytime an event happens, let's say a notice of intent or a claim shows up in your organization, and it shows up in 2015, but the actual adverse event occurred in 2009, risk actually has to go back in time and update the data. But this data is very relevant and shows the ongoing improvement. There's actually a posted paper that they have on their website if you want to learn more about the data story. This next example, which I always call the $6 million question, you know, nurses and physicians ask us all the time, are you seeing improvement in clinical and patient outcomes? And we are. We're hearing from our clients many stories, but here's an example. Actually, Linda Tyro from Texas Children's presented at the last year's APS breakfast at the AWHONN convention, and they utilized the obstetric hemorrhage course and improved their outcomes by over 40% by reducing their massive transfusion protocols, or what I like to call obstetric hemorrhage codes, to 8. This improvement continues over time. They're working on publishing a paper. They utilize GNOSIS as a starting point across their 200 nurses, and then subsequently developed a protocol to support that, and they're continuing to see and drive improvement based on those analytics. So I'd like to take a moment here and pause, and Tom is going to ask for the audience to participate in a poll.
Thanks, Laura. Yeah, if everyone could just take a second and answer this question as we get into the next part of our webinar. Does your facility or your system use a blended education, which means using online learning and instructor-led courses, you know, at the same time or in tandem? There you go, Laura.
Oh, excellent. Yeah, that's great. So 87% say yes, you're using a blended model. 12% said no. And again, we have a very large group on our phone call today, and then 2% said I don't know. But this is actually my personal experience, which is we are seeing a blended approach to online learning and educator or didactic-based learning. So this is a great opportunity. We're really excited. I want to introduce to you to Elaine Brown, Nurse Program Development Specialist for AWHONN. I'm sure for many of you on the call, you're very familiar with Elaine, and but this is a great opportunity for us to hear from Elaine. But we want to be able to recognize and tell you about our new partnership with AWHONN. The clinicians who are involved with the fetal assessment and monitoring content at AWHONN have actually reviewed and validated our content together. And so, Elaine, I'd like to welcome you to the call and see if you have any comments you'd like to offer today.
Thank you so much, Laura. I appreciate the opportunity, first of all, to be invited to be a part of the webinar this afternoon. And I'm sure I join the listeners in thanking you all at APS and with your GNOSIS program for the chance to get to know more about your program. We at AWHONN are very excited about this relationship, and it was a pleasure to have the privilege to be able to review your content.
Excellent, Elaine. And so I know we're going to get into a few more questions as we progress through here, but we're very excited about it. We think we're bringing the best of both worlds really to the field of obstetrics, and the excellent content delivered by AWHONN, and then a very innovative, high-fidelity learning platform with content that has been validated by AWHONN is really going to help ensure that we're doing the best that we can in preparing clinicians to be the best that they can be. And so that's what's really exciting about our partnership. So what this slide really is saying here is that for GNOSIS for OB really is a focus on the highest risk areas. So it's very different than, all of the content that AWHONN traditionally provides. We're very, I'm going to say very, but we're a little bit more narrow, but we're very deep in the high risk areas because these are the 4 primary areas where patient adverse events occur and where claims can sometimes surface. And we've done a lot of learning over the years on how to mitigate the risk and how to improve our clinician and teamwork around OB, high risk. So our 4 programs are fetal assessment and monitoring, hypertensive disorders in pregnancy, obstetric hemorrhage, and shoulder dystocia. In addition, we have several 30-minute case-based supplemental learning modules that we call clinical pearls. They're high fidelity, often closed claim cases, so they're real. They come right out of practice. They're de-identified. They're intended to be used as, again, supplemental and or remedial additional learning based on an individual clinician's assessment results and what they might need more support on. So for example, I kind of went through the fetal assessment and monitoring program a little bit earlier with the example from our de-identified client. You see here, we measure these practice areas for fetal assessment and monitoring, which are really important to know. We're bringing the national evidence and the guidelines. For shoulder dystocia, I think what's really relevant here on this slide is I want you to focus in on the practice areas and what we're measuring. It's really important that the nurse, even though the nurse is not a delivery provider, oftentimes, a precipitous delivery can lead to a brachial plexus injury, but if the care team doesn't have all their ducks in a row in terms of being coordinated and orchestrated, shoulder dystocia is essentially a medical emergency, and it has to activate the team. There has to be situational awareness, and we're measuring all of those components of that. Same with obstetrical hemorrhage and with the hypertensive disorders of pregnancy. So we're giving you a detailed look into, and you can also focus in and support didactic learning based on the results of your clinical team. So, for example, on the obstetrical hemorrhage, if your team scores low overall in not being able to obviously demonstrate knowledge and skill in blood loss determination, practice area 2, where that red triangle is, that's really important for the educator to say, okay, well, we have a protocol. Why isn't the team, learning it, or they don't know it? So you might have to add simulation and team training. Again, this gives you a little bit more detail in your education efforts. So this is another client's example of data that they shared at the most recent June AWHONN convention, where a client who does have a blended model and supports the poll that Tom just took. This is a snapshot of their individualized nurse assessment results, their baseline assessment results. The thing to note when you look at this graph is to say there's a lot of variation among the team. There are a few very high scores in the upper right quadrant, but I also have several nurses that are in that lowest scoring quadrant with some outliers. We see some individuals, those green dots, that are at the 40th percentile compared to their peers nationally in knowledge and judgment. So, you know, are those new nurses? Are those veteran nurses? And you have the ability to hover them over them. They're de-identified for this purpose, but you have insight into your team like you've never had before, which is really important, because I always say you cannot improve what you don't measure, and now you have the information and you can help and support these clinicians on their education journey. Another client of ours also showed their data. They used this spectrum slide that we like to call. This is before our update, but the 8 practice areas really, and they're using this data to drive additional teamwork and communication and education and training as an overall system. So they know that they scored really right at the 50th percentile for the NICHD national language. That's not acceptable to them, so they're going to do some additional supportive work around that as an overall team. So that brings us really to the end of our kind of formal slides. Tom, I will, invite you back in.
Thank you, Laura. We actually do have some questions that weren't answered that we'll pose. Someone's asked, if I am giving instruction at a hospital that also uses GNOSIS, how does the nurse or the learner know how to take a course? Do they register on their own? How do they get access to GNOSIS?
The way that APS works is really through health systems and or at the hospital level. Our program is not a subscriber-based individual program. It's not like you can go to our website and individually buy GNOSIS as an individual user. Our system is really, again, focused on overall risk and patient safety, and it's really important. We have some foundational principles around the team and standardization and effective use of national evidence across the team. And so that's why we work at that hospital and health system level.
Yeah, Laura, I think it's good to add that after the AWHONN convention where we presented at breakfast, we met with dozens of folks, and some of them are, RN frontline, and they introduced us to their nurse leaders to come on site and kind of tell them what we're all about and start that conversation. So we're more than happy to do that. And with 6 regional directors, we're close to you no matter where you are.
Yeah, and I think the one thing to know is that, you're in good company. We have over 500 health systems already using our programs, over 70,000 completed assessments. So again, it represents the largest national database for all of our programs, fetal assessment and monitoring, obstetric hemorrhage, et cetera.
Great. Another question, and I think this was answered, but I'd like you to answer it again. Someone that's interested in the measurement, the improvement measurement, how much time should pass between your baseline assessment and then when you reassess?
Sure. Yeah, that's a very good question. It's a common question that we receive from our clients, but there's a lot of factors involved in that. But because of the adult learning model, and you heard me talk about it a little bit in adult learning science, you do the assessment, you complete your learning path. That's about a 3 to 6 month time frame. And then over that year, the rest of the 6 months, depending on whether you've met the organizational threshold or not, you might reassess early if your score is really low and it represents potential risk in the organization. And or in some of these blended models, for example, AWHONN instructors do individualized support and education for those that score low. But for everybody else, it's about an 18 to 24 month reassessment cycle. But every year you're assessing on a different program. So for us in healthcare and nurses and doctors, our careers we're lifelong learners, career-long learners. So it's not like, I call it old school, but it's not necessarily old school. It's the traditional way of learning where you read a paragraph, you take a post-test, and you check the box. You're actually getting information that helps you support the journey to high reliability and improvement. And so there's ongoing activities each and every time.
Great. I have another question that came in. Is GNOSIS for OB content directed to new OB nurses or seasoned nurses?
Well, that's a great question, and I'd like Elaine to join me if possible on this one too. But I'll start off by saying, again, in this blended model, and as we've been exploring this topic quite a bit with our colleagues at AWHONN, which is there are different learning needs based on your level of experience. And the new novice nurse is going to need some different support than the experienced nurse. And so however you define that, whether it's at 2 years or 3 years or 5 years, where a nurse is considered to be more experienced, but they don't need certain components that the new novice nurse needs. They need to be assessed, they need to get their learning path, and they're achieving the organizational goals, and or they're going into some additional supportive learning and remediation. And in these blended models, that has really become a role for many of the AWHONN instructors. So Elaine, I'm wondering if you have any thoughts or comments around that question.
One of the beauties of the GNOSIS system that I found as I actually had that experience was once I as I was completing the program and saw my outcomes, if there were areas that I felt like, oh, well, I know that because I've been doing this for X number of years, I found I may have been a little surprised that I didn't score as high or my outcomes were not the same in that area, but it also gave me a very individualized proscription, so to speak, of where I needed to go to receive or what information I needed to go learn. So I think because this is that different model for learning, and it really focuses on adult learning theories that are so important to all of us, because to go into an educational experience is going to take some sacrifice on the clinician's part, whether it's our time, our money. For our managers and our clinical leaders, we're away from our units. So this really gives you the capabilities of having that targeted, focused educational experience. For me, the content, it wasn't so much that it had a specific label as to this is beginner or novice level and this is advanced. It is what we need to know in practice. And where I scored, quote unquote, using that word probably inappropriately, and Laura's probably gasping,
oh, no, you're fine.
Told me, hey, yeah, you're not a novice in this particular area of content. You already are demonstrating, and the beauty is, as Laura said several times and several slides showed, the program also looks at judgment, and that is that real-time, what could I expect of that clinician in a real-life patient care situation. And obviously the 4 areas of content that GNOSIS focuses on, because those are high-risk areas, and hopefully they're, except for fetal heart monitoring, they're low-volume, high-risk. And we want to know that we can all perform together as a team and do the right things at the right time, and there's nobody standing in the corner going, oh my, that baby's delivered to the chin and nothing else is happening. We want people to readily identify those things and begin to dance that dance to achieve the best patient outcome.
Excellent, Elaine, thanks. And I think one thing I want to underscore about what you said, which is this is the information that if you're in the labor and delivery field, that this is what you need to know to be a proficient clinician and to be delivering the highest level of care that you possibly can. So that engagement, spending time in your learning path, working with your team, you can just start to see, and again, what we see consistently, reduced variation and higher scores over time, which again is empirical data that tells us we're achieving what we want to see in our individuals, which is improvement. And so doing that in partnership with AWHONN is you know, it's the perfect scenario going forward. So Tom, any other questions for us today?
We have actually a few more questions that I'm gonna have my team answer individually. Some of them based on pricing, some of them on continuing education credits and such. So we'll get to those folks on an individual basis. But for now, I want to thank Elaine for joining us. I also want to thank you, Laura. And just so folks know, we've invited folks to this webinar. This is the beginning of our relationship with a lot more to come. And so probably within a month or so, we're going to be inviting folks back with a little bit more in-depth of how AWHONN instructors can work with GNOSIS and a little bit more in-depth on the value in the pathway of a nurse in terms of their education, especially in the fetal heart monitoring realm. So we'll be looking forward to that and hope you can join us for them. But for now, thank you.